So time is yours, Dr. Rummelein.
Good morning, everybody. You're all awake? So, I want to talk about Healite, and you know these patients, they come to your clinic and they say, look at me, please, doctor, help me. I'm losing my hair, I'm desperate. So, as you heard yesterday, I'm a good customer of Lutronic, and one day they told me, you don't have the Healite? And I said, what the hell is Healite? Yeah, it's the Healite, you have to have this, it's a low-level laser. And actually, in Germany and in Switzerland, we don't trust very much in low-level lasers. I changed my mind, but I trusted in Lutronic, so I said, okay, I go ahead, I try that out. So this is the Healite, it's available with different lamps. I decided for 2 wavelengths, you will see further in the talk, but you have different options. So, looking after patients with hair loss problems, what I do in my clinic is, the first is I do just a clinical investigation. I look at the scalp, have a look what the skin is like, what the hair is like. Then I always perform a blood check, checking out the thyroid, checking out minerals and the hormones. Then I adjust the hair care fitting to the skin type of the scalp. And I define the treatment with a local medication depending on the situation. And I always support the treatment with Healite. The most often diagnosed problems are androgenic alopecia, then hair loss due to endocrine disorders, due to malnutrition. Sounds strange, how can there be malnutrition in Switzerland? But we found a lot of times a lack of vitamin D, zinc, vitamin H, so the biotin, ferritin, and selene. This is quite often observed. And when I find it, I supplement it. So I never give a supplement just by chance. I always have a look, is there anything missing? Then, for sure, we look for accompanying dermatologic diseases like psoriasis, like aruba. There is this horrible frontal fibrotic alopecia, and sometimes there are reactions to shampoos, contact allergic reactions. So this, for instance, is one of my patients, a lady with an advanced alopecia. She has only few hairs, and they are very, very thin. Look at this. This is not a wonder, but for her, this is a little wonder. She has now the possibility to put her hair again. So what did we do? We supplemented her with biotin and vitamin D. We changed the hair shampoo to a shampoo with hamamelis, a plant, what is enforcing circulation, and we gave her 8 treatments with Healite. In the last years, I find a lot of cases with fibrotic alopecia, what is so far in our textbooks said to be not treatable, but I think we can stop that with Healite treatment. The hair that is gone out, that is lost, will not grow back, but at least it is not progressing. This is a lady with frontal fibrotic alopecia. No further progress since we started the treatment. Androgenetic alopecia with perifollicular capitis is also frequent in Switzerland, observed. And here you see his case. So we started the treatment with a steroid hair wash and Healite, and there was a rapid recovery and a rapid hair growth onset again. No recurrence since then. Seborrheic dermatitis. So you see the scaling, the redness, some pimplish spots. We gave her antifungal shampoo and Healite, and very, very fast recovery. Androgenetic alopecia on a young lady. You see the hairs on the right side very short still, but they grow back very fast. So our head is a very dynamic place. Look at her. We often find cases like this. This is a 52-year-old woman with hair loss since December 2012. She suffered from mobbing and lost her job at the same time, took antidepressants. She had a blood check. We observed a lack of vitamin D. We gave her hair shampoo and hair tonic with Rummelein, again this plantal hair shampoo, and she performed 16 sessions with Healite. Actually, she did not believe at all that this would make anything. And she said, "Doctor, I sue you if this is not working." I was like, oops. So now I trust in my Healite, and this was her course. She's my big advertiser now, because everybody saw immediately that she had a big change. Another case of androgenetic hair loss. And this lady, you also see the hair is very dull. It has no shape. She cannot make up her hair. And the amount of the hair has changed and the quality of hair itself. Here maybe a bit less obvious, but very content patient also. So no wonder, but a big improvement. This gentleman just came in. This was just last month. He had 16 treatments with Healite, and very, very happy about the result. Again, thicker and denser hair. Let's see. Working or not? Thank you. So this is just to show you how this treatment is performed. Very easy. The patients like that very much. It's a very relaxing treatment. It takes 13 to 16 minutes, depending on how you program it. It's slightly warm, but anyhow so relaxing that people fall asleep. So they really take a nap, and then 5 minutes sleep. Then the nurse comes in again and says, "Okay, you're done." And they love to come back and say, "Can I come more often for that?" I say, "Yes, you can." Okay. These are the settings. Okay, the same machine is used for wound healing. I use it basically for patients with acne, especially for those with skin picking disease. Because if we have an acne patient, we have classical insurance-covered treatments. So we can offer a lot of treatments for the patients. But skin picking disease is a problem because it's more a psychological thing than it is. Then I can work on it with acne medications. So rosacea, especially those cases of rosacea to whom I cannot give tablets because of other contraindications, we use it after PDT to make the skin recover faster and on surgical wounds. So let's share the first case. This is a lady with skin picking disease. She came in and thought she has acne, but for sure she has skin picking disease. And she was in treatment already with 3 different doctors. She has a psychologist who's taking care for her. There was no way to stop her from picking her skin, and because it never healed, and she always started to pick the crusts again. And this is her with after Healite. the first time that somebody managed to stop her this vicious circle and that the skin was able to recover. Another case, this gentleman with a severe onset of rosacea. He was under steroids from his house doctor because he had the idea to cure this with steroids. So stopping the steroids, you can imagine the skin exploded. And then it was not able to give him antibiotics because he had some internal problems. So we went to start with Healite and rapid clearing of the rosacea. This gentleman with seborrheic eczema had all classic treatments for seborrheic eczema. Recurrence, recurrence, recurrence. No way to have a stable skin situation. Under Healite, it healed off perfectly. So the third major indication what I use the Healite for is the PDT. And I do the special version, I do the laser-supported PDT. So the patients come to my clinic with a pre-numbed skin with anisderm or amla. Then we perform the CO2 fractionated laser. We open the skin in order to have a better drug delivery. We apply, this is then how the skin looks like after the CO2 treatment. Then we apply the Medvix, the ALA, and let it incubate instead of 3 or 4 hours under Band-Aid. We incubate it only 1 hour open. No Band-Aid, not covered. So the patient is sitting in the waiting room having a coffee, slightly red with a bit of cream on his face, reading a magazine, no problem. And after exactly 1 hour, we call the patient in. We check how good the absorption of the porphyrin reaction is with the wood lamp. And we prepare for the light. We remove the Medvix, put the patient under the light. And for comfort, we have a Dyson cooler. You see that the Dyson cooler gives some wind. So before performing PDT, patients said that the pain level is about 8. If you have the scala from 0 to 10, they said it's about 8. With this version, what we do, they say it's about 3. So see with the Dyson cooler, the reaction is the same like on the other version. So on day 3 or 4 is the worst. There can be a pustular reaction. This is a lady from Israel. She had it done on her forehead and on the nose. We never do the full face at once because this is too much. We have a lot of sun damage in Switzerland, and these patients, they would suffer enormous, so we do just partial. Here you see the nose, perfect recovery, perfect aesthetic result. Scalp is very often, this is an old gentleman over 80 years. Residual keratosis can be treated with cryotherapy and then everything is gone. And they have another 5 years to live with their skin without problems. Décolleté is a serious spot. It takes longer to recover. But look at this. This is the décolleté of a 74-year-old. No wrinkles, no spots after PDT. This was what it was before. So very good aesthetic treatment. Another nose, a cheek with Morbus Bauen, another nose reaction. So you see also with incubation of just 1 hour, the symptoms are the same. Hence, again, very, very difficult, but comes to perfect results. And here another heavy reaction with a beautiful outcome. this is, I think, my last case on this subject. This lady, she had, see here, this whole area, she had a biopsy done at the university hospital, unfortunately by an assistant with an ugly scar afterwards. And then here, another big spot. We performed the PDT and everything gone. And I want to share with you another interesting case. This is a young lady. She is about 40 years old. And she showed up in my clinic with this scalp. Red, a lot of hair loss. Treatment, pre-treatment in another clinic with steroids for 3 years. She had topic steroids for 3 years. So looking at the scalp, you see a lot of telangiectasia, and the skin does not look healthy. So we took another biopsy, and this was also morbus Baunoid actinic keratosis. So we performed the PDT in total 3 times with severe crusting, severe reactions. And step by step, the skin recovered and the hair grew back. This is when she came in. This is what she's now. And especially, she wears a hat now. So I really have to say I'm not an advertising person, but just to share this experience with you as a colleague, this is the best investment I ever did, and it was the biggest surprise for me, because I did not expect it to be so good. Thank you very much for your attention.
Please, if you have questions or comments from the audiences, please don't hesitate with them. Dr. Rummelein, can I have a question for that? Sorry, Dr. Narula. You're using the 633 on the PDT with the MedPix and giving a lot of reactions after the PDT. So, but 830 nanometer wavelengths you're using for the wound healing. So do you usually combine them? And what will be the protocol you have?
I do the normal PDT, and then afterwards I call the patients in for day 1, 2, and 3 for the wound healing. I did not mention this, that's right. I use the wound healing success with the Healite for sure. This is a nice service because if patients look like that I showed you the photos, where can they go? Nowhere. The only place where they can show up is my place. So they come and I say, yes, that looks fantastic, horrible, so you are on the good way.
Thank you. Thank you for your good lecture. And any other questions or comments? Okay. Thank you, Dr. Rummelein. Second speaker of today's session is Dr. Jas Narula, and he is running his clinic in Australia, Perth, and he graduated with the University of Tasmania, and he got a diploma in OBGY in Adelaide. And he is a founder of the Australian Society of Cosmetic Medicine, and he is working as a business development manager in the Cayenne, and he is holding society memberships with the Australian and New Zealand, the societies for the OBGY and the cosmetic practices. Please welcome Dr. Narula. It's time for yours.
Thank you. Thank you, ladies and gentlemen. My aim today is to share with you my experiences with the petite lady. When I was asked to present, what struck me most was the fact that the sheer enjoyment I've had in using this device in the few months and the benefit it's given to my clients is quite amazing. There are not many moments in medicine where we tend to find new technologies that create such significant change. My first foray into aesthetic medicine was in 1999 when a colleague of mine took me to look at this amazing machine, intense pulse light. then relatively new. And fortunately, by the time I joined the clinic, they had burnt everyone they could the previous year. By the time we joined, we learned how to use it effectively. And one of the cases that struck